Hi there, Dr. Brian Evans here. Quick update on a couple of things, the most pressing things that are probably on your minds as well as on mine. So we're going to talk a little bit about COVID and the Delta variant, and we're also going to talk about Anthem Blue Cross. So COVID, with this Delta variant, we're now seeing that Delta is really rapidly replacing other variants in the United States, and it's resulted in quite an increase in the number of cases across the country, including in our region. And it's also resulting in a lot more hospitalizations going on, not just here in our community, but across the region. So we're seeing more hospitalizations, which actually has started to affect more younger people now. The vast majority of the hospitalizations continue to be folks who are unvaccinated or incompletely vaccinated. But it's still possible for folks who are vaccinated to get sick and end up in the hospital. So the vaccines don't protect us 100%, but they certainly protect us quite a bit. The folks who really should be careful, even if they're vaccinated, are those over the age of 65, and also folks who have an immune system issue where they can't really mount a great immune response when they get vaccinated. So even though they're somewhat protected, they still need to be cautious because of the spread, which is fairly rapid, of this Delta variant. So that's what's going on with COVID. So a lot of the same precautions that we've talked about over the last year and a half are still things that you need to consider, mask wearing in the proper setting, and also social distancing when possible. Also, the governor's office of the state of California issued an announcement today that healthcare facilities, healthcare workers are going to be required to either be vaccinated or to be tested roughly once a week. And we're still waiting for a lot of details to come out on this announcement from the governor's office, but we'll certainly be in full compliance. By the way, we've certainly offered testing throughout the entire pandemic to our employees regularly, and we've of course offered vaccination as well. So this won't be too surprising for us. Now, the other thing I want to talk about today was Anthem Blue Cross. This has been a very concerning and disruptive situation for really everybody concerned. Certainly everyone here at the hospital, physicians' offices, and patients, of course, are concerned about what it means when Anthem Blue Cross is failing to contract with Dignity Health. These are negotiations that are happening on a very large scale, but it absolutely affects our community. Just so you know, Anthem Blue Cross is a very large for-profit insurance company that is extremely profitable. Just in the last 6 months, they posted profits of approximately $3.5 billion. And they've been very profitable for the last several years with a very significant rise in their stock prices. They came into the negotiations with the mindset that they wanted to reduce our reimbursements to our healthcare system. And that's really not sustainable for us because we're a not-for-profit healthcare system that takes care of the vulnerable and takes care of communities just like this one. And so we really do have to have a margin in order to continue to provide those services that are absolutely crucial. So we do want to reach an agreement with Blue Cross and of course other insurances, and that's what we intend to do. So we're going to be back at the table every single day and making sure that we can get that done as quickly as possible. So if you have questions about that, I'd recommend two things. Number one is you can certainly go to the internet and go to keepdignityhealth.org, and there's all kinds of questions and answers on that for you. And the other thing I would do is recommend you call Anthem Blue Cross and tell them that you really want them to go ahead and make sure that we continue to be able to provide access to healthcare for everyone in the community. Thank you very much. Certainly put your comments here and we'll do our level best to answer all of them. Thank you very much.